So this is a pre-event massage for the lower extremity. So the aims for a pre-event massage are really to stimulate circulation and get the tissues in the best possible physical shape so they can perform in the game or race that the athlete's undertaking. The technique should be light, they shouldn't be causing any discomfort at all, and it should be quite a brief session that should take about 10 to 15 minutes but as part of a pre-event massage. So to start with, we're just going to mobilise the hip joint, moving into hip flexion, just gently working into resistance, and then stretch the tissues into lateral rotation, medial rotation, and we can also put some gentle movements to the knee joint just to encourage full range into flexion and just ensure we've got full range into extension at the same time. Once we've mobilised joints, then we can start working towards the soft tissues to really get circulation moving and get the athlete in the best possible physical shape. So the techniques are going to be really quite light, they should be brisk, they should be pretty superficial, and it should be about getting circulation moving and invigorating the patient at the same time. So with all these techniques, we're going to start with some effleurage techniques, so double-handed work and double alternating techniques, just really quite gentle and quite light, and you can start feeling warmth underneath your hands. Then we can start progressing towards some kneading techniques with the heel of your hand, working towards vastus lateralis, and then more laterally round towards rec fem and also vastus lateralis as well. That open C technique's a really good technique for pre-event massage, where our finger pads are working towards medial structures, and my thumbs on the lateral side are again just working around in small circles just to get blood flow moving, get heat in towards the tissues. Ringing techniques are good for pre-event. Lifting muscle bellies upper and separating deep from superficial. Or we can make that a bit more focused onto a target muscle group. So with a pre-event massage, then our target's going to be the muscles that are going to be utilised by the athlete. So make it relevant and make it specific to the needs of the individual. And back towards your open seat. Okay, so deportment, it's your choice what technique you use, but we discussed hacking, cupping and pounding earlier on. So pick your preferred option. And you can see we've got heat in towards the tissues, we've got that erythema, which is exactly what we're looking for. And if in doubt, really, you're going to go back towards your effleurage techniques, working up through the length of the tissues. Up to here. Down towards the knee joint, then working lateral and medial to the patella, and round the joint line on the medial and lateral side, some circular work round towards collateral knee ligaments. And we can again encourage a bit more knee flexion just by moving and mobilising into flexion. Right, to work into gastrocs, just to make sure the tissues are nice and relaxed, then I'd do this supine and sit on my partner's knee just to stabilise it and make sure a nice secure position. From here, you've got a double alternating technique through both respective gastroc heads with finger pads. You can take that technique all the way up towards the proximal attachment, and the same on the lateral side, really lifting up tissues and moving back towards you. A bit more focus work in towards the musculotendinous junction to get some heat in there and get blood flow. And we'd even put finger pads between gastroc heads, just running up between them and then separate and pull up towards you when you get towards the proximal attachment. You can gently make sure the tissues are nice and mobile by using your finger pads, or you can do deportment using your radial border, and you can see we're getting nice sort of movement and mobility through the tissues. Back into effleurage work. And I'd also do some circular work around towards perineals and also those anterior tissues like tibant and your extensors on the front here. Down towards the foot and ankle joint, I'd gently mobilise that talocrural joint, and I'd do some work around, again, the medial ankle using my thenar eminence, just circular work to get some warmth in towards the joint, and the same on the lateral side. Down towards the plantar fascia, so finger pads are going to sink in towards the plantar aspect of the foot, and I can just pull back towards me, so stretching out over towards the toes, and just lengthening and working through all those deep flexors underneath my finger pads. And gently just put a really gentle stretch into dorsiflexion. So overall for a patient, it would take about 10 or 15 minutes to cover both legs. So it should be quite a brief session, quite a brisk session, shouldn't be causing discomfort, and it's about getting your athlete in your best possible physical shape before they take part in their race or game.